Good afternoon, everyone. Dr. Popat, Dr. Ramakant Patil, and my friends. I think when I was asked, not only asked, but forced to come here and give some talk, I thought I should talk on something which is very close to my heart, and that's why I have given a title, Are We Pediatricians or Vaccinators? Friends, when we talk about vaccines, we must know that we must use all vaccines as often as possible to as many children as possible. But that's not all. There is much more expected out of all of us, and that's why I thought that let us not be only the vaccinators, but let's be the pediatricians who also vaccinate. And two things are very different, and to my thinking, therefore, there is a difference between a pediatrician and a vaccinator. What is the difference really? Vaccinator delivers the vaccine to the recipient and has no responsibility at all. He is a technician. Okay, do we want ourselves to be just the technicians? Yes, we will have to give vaccines because when patients come to us, they need not go to any other physician just for vaccination. That's not fair. But it's not also fair that we just vaccinate and leave them alone. I am afraid whether many of us may not be doing exactly what we should be doing. And I thought, therefore, let me tell you what is the pediatrician different than a pediatrician vaccinator and a vaccinator himself. A pediatrician delivers the vaccine to the recipient, but has far more responsibilities and has to acquire adequate information, knowledge, wisdom about the vaccine use and counseling ability. I'm sure each one should take a vaccine, every vaccine that is possible, but in real life that may not be feasible for varieties of reasons. And I think we need to kind of address the issues in individual capacity to an individual parent and try to see that the child is well looked after by you and me and not just vaccinate. After all, the idea of vaccination is to prevent a specific illnesses against which the vaccines is used. But are there not any other ways to also prevent illnesses? And would a vaccine guarantee a prevention of an infection and a disease? I think this is all that is important to be passed on to the parents so that we are not blamed thereafter with any accidental failure, not because of you, but finally you gave it, and to that extent that is very important. And I think even legally it is important. And that's why I thought that what we all must also do is to take this opportunity when parents bring their children for vaccine to advise about physical and mental health of the given child, ideal lifestyle, which includes nutrition, exercise, adequate sleep, hygiene, mindfulness, to remain healthy. I'm not sure even whether 5% of us are doing this. Let us introspect ourselves. There cannot be an excuse that I have no time. If you have no time, restrict your work. Get another partner. Let the parents go somewhere else. But you cannot do haphazard work. Can a surgeon say that I will operate on this issue for an hour, and if the hour was not sufficient, can he leave the patient? No. How can a physician do that? I'm afraid most of us do that. And I think this is just to make us sensitized to an issue that vaccination is fine, but vaccinator alone, pediatrician becoming a vaccinator alone has a pure commercial motive. I have nothing against commercial motive, but I am against having that motive without giving adequate benefit of the parent visiting you for his child. And I think that is very, very important, and I am afraid majority of us will not be doing that. That is not right. And I know any time if I see a pediatrician's child, he is so much worried. I wonder whether he is equally worried, though not emotionally attached to the parent, but is he equally worried and feel that he is doing the best that he can? And I'm sure vaccination is one such issue, and I will just take you to do that. Well, we have enough information, and we have often a digested information, which is knowledge. IIP has been having an immunization committee for so many years now, and we have had periodically an immunization book coming out, which gives all details, not only of information, but knowledge, justification, why we do this, why we don't do that. And there is enough information and enough knowledge. But this knowledge is very passively transmitted through our guidelines, through our recommendations. I'm sure they're important, but much better would be that you understand why that is so. And therefore, like it's not enough to take food in, it has to be first digested. And only the digested food gets absorbed. And digestion means breaking down into small molecules. And the information of vaccine that we gather must be broken down to small molecules to understand how we can make small changes suitable for a given child. I'm sure this is important for us to learn, and a mere vaccinator doesn't need to learn all that at all. And that's why I thought that, can multiple vaccines be given together? Parents might ask you that, and you need to have a definite thing. I'm sure many of you may not have thought that the BCG vaccine is itself a multiple antigens. Where was the problem of giving multiple vaccines together? Even in that single BCG vaccine, we were giving multiple antigens, as if there were the multiple vaccines. Now, when we know that, then we know that there is a rationale behind, safety behind, convenience behind. But not all vaccines can be mixed together. And I think all this information we have a passively transmitted infection. You just read that and think for a while and make it an active participation yourself to understand the reasons behind that. Why have different vaccines for the same disease? Are all vaccines equal in their benefits and risks? Why different schedules for different vaccines? We are told that 0, 1, 6 may be the ideal schedule. Then why do we have 6, 10, 14 weeks? Why don't you have an ideal schedule? I'm sure many of us may not be aware of all this, but if you are unfortunate to meet a very educated parent, then he might ask you all that, and you have to defend yourself how your association and the recommendations are very true to their last spirit. And I think we need to do all that. There is always a concern, why specific timing, how many numbers of doses, what intervals, what frequency. Unless we have the digested information absorbed, retained, and then reused, we will not be able to answer all these questions. I'm sure we can even satisfy every curious parent by giving very confidently an answer which may be totally wrong. But we want to be right as well, and for which we need to know all these things. I'm sure all these things are very much available in our books. But the major problem is we know, but we don't think. And when we know but we don't think, we cannot implement it. Like we often see but not observe. We often hear but not listen. And those are the finer cortical functions that we need to put in here. And therefore, there are a lot of practical problems that all of us must have faced. And I think we are aware to answer in one way or another confidently, but we need to be ourselves conscious that yes, that's the best and the right answer, because if we ask somebody else, there should not be any dichotomy on that. Having said that it's not enough for us to gather information and knowledge passively, but we need to actively attain the knowledge, which means actively digest it, actively absorb it, actively retain it. How will you retain it? You may have to revise it so that it's retained forever, and then it can be retrieved as and when necessary. And I think that is most important for vaccine for me, that I must know the reasons behind all these various issues that I just talked about. And that, I think, is important. Books may have given it, but we need to understand them, to reproduce it, and to tell the parents exactly what it means and how it is. If you are able to confidently say all that, then you have done your job as a pediatrician and a vaccinator. And I think that is important. But finally, friends, wisdom is something beyond a knowledge. And what is wisdom? Wisdom is to know which knowledge is to apply to which child. For example, we all know that in botany, a tomato is a fruit. Yes, that's a knowledge. But what's the wisdom? Don't put tomato in a fruit salad. And do you imagine that even the fruit sellers and the vegetable vendors know this, because tomatoes are available with the vegetable vendor and the fruit stalls don't keep tomatoes. I'm amazed to know they know this, but we may not know this. I think wisdom lies really there, and I think the right product for the right child at the right time. For example, some product may be cheap. I must say that I would compliment the Indian vaccine manufacturers that they have done a wonderful job right through COVID, where we supplied vaccines to many countries, and now many vaccines are produced in India, and they are authentic, they are efficient, they are safe, they are often cheaper. Okay, and therefore, I think to select the right product for that right child and to be given at the right time. My next question is, are all vaccines for all children? What I mean by that is, if some parents have to spend a lot of time for vaccines which are not given free of charge by the government, then would they be able to afford it, or would they be able to do it at the cost of nutrition or a cost of health, maintenance of the family? We may have to give us some thought to it, because while the vaccine is good, vaccine is essential for everybody. But all the same, there has to be some thought given to this effect also. And then the question comes, why IAP recommendations are a little different than the government recommendation? And the reasons are very clear, that this cost-benefit effect has to be weighed by the government at the larger level, at the macro level. But don't you think we should also consider it at the micro level? Not every patient who sees you and me in our office can afford every vaccine, in which case we may have to prioritize. In the first year, we give so many vaccines, and therefore the parent may well spend so much of money. Can we modify our schedule and place some vaccines a little later without sacrificing the safety or efficacy or the need, but managing it correctly? I'm sure IAP will give a thought to this and guide all of us as members to say that if you have a budget of X amount, which is not enough for giving all vaccines in the first year, which vaccine could be spread out a little later, fairly safely, though not ideally. There is a time to think of this. Then only we know that we are actively participating in the whole program of vaccination. The question is, do we decide all such issues? I remember when I was a medical director at Wadia Hospital, those days the liver transplant was just coming in. And one of our specialists suggested a liver transplant to a parent who did not have enough food to eat. They came and cried with me and they said, "Sir, because I don't have money, my child is dying. I'm feeling guilty." I was wondering whether we should talk to them about liver transplant when they can't even have food to eat. But yes, we must give all the information, but we can give information in a different way. We could say that liver transplant is available today, but one is cost. Suppose we have a donor, that is not enough. It's a lifelong cost at multiple issues. If this child cannot even be assured of nutrition, how can that liver transplant alone help the family or the child? So we can give the information in a manner that the family will not feel guilty of killing their own child. And believe me, at that time, Vilasrao Deshmukh was the CM of Maharashtra, and he died while getting liver transplant in Chennai. I told him that even he is not assured of the success. Okay, let's try something that is possible with us. Their guilt feeling was removed. I feel we all have to be very, very vigilant about such issues. It's not only science, there is an art as well. And therefore the question is it legally right to not say what is available? No. But there is a way to say it, and therefore we should be morally right as well while we are legally right. And I think these are some of the things that I feel are very, very important. Lastly, counseling is the most important, not only in vaccinology, in everything that you do. Why do you write an antibiotic to a viral infection? Because there is no question asked. You can't be wrong. How can you not be wrong? Giving antibiotic to a viral infection is right. Is it safe? But you can write, it's a viral infection, don't worry. Take amoxicillin and go. And he is happy the amoxicillin worked. Are you satisfied with this kind of a thing? Then will you say that, I don't know the diagnosis, I feel mostly it's viral, but I'm not sure? He will leave you. What do you do then? You be honest and counsel rightly. You tell them that I don't think you need an antibiotic, but I may have to change my mind. I will wait for 2 days. Your child's life is not in danger. I am very sure about that. And I am reasonably sure I am right. Your child mostly will be all right. But if not, nothing is lost. But I have prevented unnecessary use of antibiotic, which is harmful. Do I counsel this? Yes. Do they accept it? 100% yes. But we don't do it. And I think that is why reasons behind our decisions of vaccine, what are intended benefits? No, sir, I have heard that somebody took a COVID vaccine and still had a COVID and he died of that. Yes, even I have heard. That doesn't mean that COVID vaccine is useless. I need to explain them all this. Limitations of vaccine, side effects of vaccine, changing advice on vaccine. Till last year we were saying that the males don't need an HIV vaccine. They reserved only for females, the HPV vaccine. Now it is also for males. Now when I tell a male child, the parents will ask, but previously our elder child, you said it's not for males. We need to justify how these things have changed. We used to give MMR only once, then twice, now 3 times. We need to do all that, and I think that all needs counseling. And what about age-old general vaccines? Have we ever told parents that there are many other methods of preventing disease? Our vaccine is the only one. We almost never do that. What about SMS now in the COVID period? Forget all the vaccines and remdesivir and all that. Finally, what happened? Everybody said social distancing, masking, and sanitization. Have we come back to where we were? And do we say anything of this kind at all when we give vaccines? My answer is no. My answer is never. Why never? They did not ask. But they were not supposed to ask. You were supposed to tell them what you know about it. And I think even lifestyle. Today we might say obesity is increasing even in rural areas. But what the hell are we pediatricians doing? Are we charting the growth? Are we picking up a weight going up? No, we don't. And we say, oh, obesity is increasing. Parents are at fault. Okay, fast food is available. Have we been fast enough to think what we are lacking? We are not. And I think my only summarizing is, don't vaccinate without counseling. This is true of everything that we do as pediatricians. Observe the patient for 15 minutes before allowing him to leave. We all took COVID vaccine and we were made to wait there. They checked out while going out that yes, you had waited. Did the government not follow it? In a mass vaccination program, do we follow it necessarily? Well, mostly nothing happened. Mostly no, but something might happen, and you are responsible. Make a habit of doing that. Document properly for legal safety, and I'm sure I see all of them now have a sticker, and you put the sticker that you are vaccinated. Ensure ideal storage and sterility. Prepare one page of information so that you don't waste time talking, or your assistant may do it. Your receptionist might do it. It's not necessarily that you have no time and you have no time to counsel. You have many ways of getting over the constraints that you have, provided you are motivated to do it. And I think use opportunities to educate parents about health. That is most important. Remember, we are health promoters and not just disease managers, and certainly far from being just the vaccinators. Thank you very much.